Well, I'll tell you, our next speaker is a man that I truly admire and somebody that I have the privilege of being able to work alongside. Dr. Zach Walsh is working out of UBC, and he is one of these researchers that takes things to the next level. The reason I say that is because UBC actually has a cannabis research room. You know, I'm not sure what goes on there yet, but I'm very interested in learning more and supporting Dr. Walsh in, heck, whatever he needs in order to further that research. So all things aside, Dr. Walsh is somebody who, once again, has a wonderful combination of tremendous statistical insight and at the same time has the heart of the kind of person you'd like to have as your neighbor. He's a kind and decent human being, and I'm so fortunate that he's here today sharing with all of you. Now, Zach Walsh, PhD, he's a clinical psychologist and an associate professor of psychology at the University of British Columbia, where he directs the Therapeutic, Recreational, and Problematic Substance Use Lab. He has published and presented widely on topics related to medical cannabis use and cannabis and mental health. Very important area. He is the lead investigator for several ongoing studies of the therapeutic use of cannabis, including a clinical trial of cannabis for PTSD and a federally funded study of the effects of cannabis legalization on health and well-being among young adults. Please join me in welcoming Dr. Zach Walsh.
Oh, thank you so much, Michael. Thank you for inviting me to this great event, and thanks so much to the speakers that came before. It's really great to be able to hear what everyone's up to, and great to hear from Terry Lake and from Philippe and MJ, and really just an honor to share the stage with some of the real cutting edge research in cannabis, and it's so exciting that so much of it is taking place here in BC. So I think they've done a great job of really focusing us in on the opioid crisis and the role that cannabis might have to play there. I'm going to talk a little bit today about broader issues of mental health, and we know that mental health and substance use go so closely together, and so many people who are suffering from the opioid epidemic also have comorbid mental health conditions. So I want to look a little bit at how cannabis can play a role in not only addressing addiction, but addressing some of the things that tend to go with it and that can make it more complex to treat and to get over. I want to talk a little bit about PTSD in some detail, and also talk about pain and mental health, because as Philippe was saying just before me, those things do go together as well. So we see such high rates of mental health and depression and anxiety problems in people who suffer with chronic pain, and also the converse as well. So just to disclose, to get started, my research in the PTSD study that I lead, and together with Ian Mitchell, who's also here, co-lead the study, and Philippe and MJ are actually involved in that study as well. And that study is funded by Tilray, so they support the research, and they support my graduate students. They don't provide me with any direct compensation. And the research that I'm going to talk about today has also been funded by the Canadian Institutes of Health Research, Social Sciences and Humanities Research Council of Canada, the Institute for Healthy Living and Chronic Disease Prevention at UBC, and MyTax, which supports some of my students who are working on this research as well. So as I said, I want to talk about a systematic review of cannabis and mental health. It's such a big topic, because when we talk about some of the risks that tend to be associated with cannabis, particularly in more stigmatized times, mental health comes up as one of the big issues. You know, if it's safe physically, but what does it do to the well-being, particularly of young people? Amongst the mental health conditions where cannabis is a treatment, can be used as a treatment, PTSD really sticks out. And I'm sure many of you have heard discussions about that. There's a number of advocacy groups, veterans and other people who suffer with PTSD who have really joined together around their findings that cannabis is helpful. So we're going to talk a little bit about that, and also talk about mental health and pain. So where this journey really started for me as a clinical psychologist, I guess around 2009, and also where I first met up with Philippe, we were doing a large survey of medical cannabis patients in Canada, and 2009, 2010 is not that long ago, but in medical cannabis, it seems like a real long time ago. And that time, we really didn't have a whole lot of good baseline data about why people were using medical cannabis. Certainly, the people on the front lines, like Philippe and Hilary Black, who's mentioned earlier, had a lot of anecdotal evidence. They were speaking with patients, but it hadn't been systematically collected in the way that we'd like. So we did one of the first and biggest studies of medical cannabis patients in Canada, over 600, and we found that amongst the symptoms that people were treating, people were using it for sleep, also for pain, not surprisingly, but anxiety and depression were also huge reasons why people were using medical cannabis. And that was really interesting because, the story about cannabis for a long time was that it made you crazy. There was difficulty in finding physical health consequences, but certainly it was bad it was the assassin of youth. It would destroy your motivation and drive you mad. And so instead of that, what we see is people using cannabis to try to be more sane, to try to address some of the common conditions that plague so many of us, anxiety and depression, sometimes described as the common cold of mental health, although it can be much more serious than that, but so prevalent. So much of the pharmaceutical drugs that we use are meant to address these conditions as well. So we're interested to see that's how people are using cannabis. And it really is, as I say, a controversy, and as it became more prominent, I had so many other clinicians, I'm a clinical psychologist, so many other clinicians asking me, what is up with cannabis for mental health? I have patients who seem to be sincere, and they're telling me that cannabis is helpful in managing things like depression and anxiety and trauma, and that really does take up a large part of your practice if you're a clinical psychologist. Yet in grad school, we're typically trained to see cannabis use as a symptom, harmless at best, but really part of the problem. Yet we have to follow where the patients are at. So if patients are saying that this is helpful, I'm of the opinion that we have to take that seriously. That's really one of the things that's been so powerful about the medical cannabis movement is how patients have been leading the way, and us scientists are just sort of following up. So much respect for the bravery of the patients and the people on the front line who took these chances and were able to speak against the stigma, so that now we can really have an open conversation in a mainstream venue like this, where I can tell you about how some people are using cannabis to address mental health. So in response to this, we said, okay, what do we really know? And just another quick, maybe an axe to grind, if you will, is that people say, and sometimes the medical community says there's not enough evidence, and we certainly need more evidence. That's something we can always say, and it's always the case. There's not too much evidence. But when people say there's no evidence for medical cannabis broadly, that's simply not the case. Particularly in the case of pain and for other conditions, there are large studies. They're not all randomized controlled trials, but there are also some randomized controlled trials. But there's large studies of many patients and many individuals who are using cannabis. So we have to listen to that evidence. We can't just sit and wait and say, there's no evidence. And so what we did is we did a guided systematic review looking at all the literature on cannabis and mental health. And the literature on recreational cannabis is so broad and so big and so focused really on problems. I mean, it's very difficult to get funding until recently to study cannabis in any way other than to look at the problems. And that's part of why I'm so grateful to companies like Tilray and other licensed producers that are funding this research. But for a long time, all the research on non-medical cannabis use was focused on problems. And there's a lot of it. So we couldn't review all of it. So for the non-medical cannabis use, we looked only at reviews. So we reviewed existing reviews. But when it came to cannabis for therapeutic purposes, medical cannabis, we were able to do a comprehensive systematic review. And that means we looked at all published studies in the medical literature that looked at medical cannabis use and mental health. Mental health defined as it is in the DSM, the Diagnostic and Statistical Manual of the American Psychiatric Association. So all the DSM categories of major mental health. And we found 31 studies there with almost 24,000 participants. So again, not RCTs, they don't imply causality, but they do have a lot of information in there. A lot of them are from Canada, a lot of them are from California. We also had some from England and some from Australia as well. And so here's what we found going category by category, and I know there's a lot of clinicians in the audience today, so I'm hoping that this will be informative. When we looked at the symptoms that people treat medical cannabis with, anxiety is one of the top ones, and anxiety is one of the things that many people struggle with and that many people use pharmaceutical drugs and also other drugs to deal with. We found 8 cross-sectional studies of medical cannabis users, and in all of those studies, people reported relief of anxiety as either the main reason why they're using medical cannabis or as a secondary benefit. So in all of those studies, people said that cannabis helped with their anxiety. In one study where cannabis use was started and stopped, it noted a return of anxiety after the cessation of use. So even a bit of a stronger signal that the cannabis use was dampening the anxiety. Of course, the most prominent medicines now used for anxiety are benzodiazepines, and I'll just touch on later on some of the limitations of those drugs. All drugs have risks and benefits, and so I think it's important when we look at mental health to be able to weigh them and say, how does cannabis stack up not to perfect health? How does it stack up to the treatments that are available right now? So in the case of anxiety, that really leaves us largely with benzodiazepines like Ativan and Valium. We also found 2 reviews of non-medical cannabis use. In those studies, there were small positive associations between cannabis use and anxiety. But that's what we'd expect to see with any drug that's being used perhaps to treat anxiety. If you were to look at a study of depression and antidepressant use, you'd see that people who have depression use more antidepressants. We don't understand that to mean that antidepressants cause depression. So there's really no causal association when we look at this non-medical model between that small relationship between cannabis use and increased anxiety, and the authors of the reviews came to the same conclusion. When we get to depression, another very prominent, common mental health concern, we see a very similar pattern of results. So the 9 cross-sectional studies of therapeutic use that looked at depression, in those 7 of them noted mood improvement amongst the consequences of medical cannabis use. As you saw in some of Philippe's research, often people are using cannabis for another primary condition, often it's pain, but when they're also asked about their depression, they would say that, yeah, I had depression and the symptoms were reduced using medical cannabis. In one of these studies also found that people with severe depression had higher rates of problematic cannabis use. So the more depressed people were, the more often they were using cannabis. And problematic cannabis use, I think, is a difficult concept to really adequately capture in the case of medical use, because when we diagnose problematic use, it often has to do with frequency of use. It might have to do with difficulties in accessing it, being worried that you're not going to get it. All of those are symptoms that people ascribe to problematic use, but in a medical context, there are many reasons why you'd be concerned about your supply of cannabis, why you'd be spending a lot of time worrying about it and thinking about it if your supply is uncertain and perhaps illegal. In our reviews of non-medical use, similar to what we found with anxiety, a small positive association. So in the general population, cannabis users slightly more depressed than non-cannabis users. But we find that with all substances. So whether it's alcohol use, cannabis use, any kind of drug use is associated with higher rates of depression. And it's hard to tease that apart in non-medical use from the stigmatization and marginalization of people who use substances. One of the big issues and big concerns with cannabis is, of course, psychosis. And when I think about what I see as some of the best evidence for problems associated with cannabis use, psychosis is certainly among them. There is evidence of increased earlier onset of psychosis amongst people who are at a genetic risk when they use cannabis. So cannabis has been found to perhaps trigger an earlier break of psychosis. However, the evidence doesn't suggest that cannabis leads to psychosis or schizophrenia amongst people who aren't otherwise at risk. And one thing that I find very compelling, when we look at the base rates, we see, huge increases since the late 60s, early 70s to now in rates of cannabis use, where rates of schizophrenia have stayed stable. So if cannabis was causing a psychosis de novo, if it was causing it on its own, we would expect to see some increases in the rates of schizophrenia, and we simply haven't seen those. It's also difficult to establish causation when we look at studies of cannabis and schizophrenia, because before people develop a full-blown schizophrenic profile, they may have some symptoms, some psychotic-like symptoms that emerge. And there's evidence that cannabis can be used to treat those symptoms. So we don't know if people are using cannabis before they have a psychotic episode and the cannabis causes that, or if they're starting to see the beginning of some of those symptoms and trying to address them themselves. I won't get into some of the differences between THC and CBD, the main active ingredients in cannabis, but whereas THC might provoke psychotic symptoms, CBD has been found to have antipsychotic effects. So there is a reasonable reason to believe that people might be using cannabis to reduce some of their psychotic symptoms and thereby causing the appearance of cannabis preceding a psychotic episode. One thing that I find very interesting is that when we look at medical cannabis use, and of course it's something that has just skyrocketed over the last few years, and there's been a lot of attention to it, we don't see cases of people reporting schizophrenia as a side effect of starting medical cannabis treatment. I haven't even seen case studies of that, and it seems like the type of thing where if that were to emerge, it would be something that would be disseminated and discussed in scientific circles, and it's something that I simply haven't seen. So I think the take-home on cannabis and schizophrenia is that it might impact the course of the disorder, but that it doesn't cause psychosis. Of course, we're very interested in the neurocognitive effects as well. What does cannabis do to your memory, your short-term memory, your thinking, your executive functioning? And so we looked at that also in our review, and we found 2 studies of therapeutic use. I have a star there because only one of them was included in the review. The other one came shortly after. And amongst medical users, one study found improved executive functioning. So that's improved mental control, ability to organize your thoughts after 3 months of beginning cannabis treatment. And the suggestion by the authors was that this was due to symptom management. So certainly chronic pain can interfere with your ability to concentrate and your executive functioning. So to the extent that cannabis was effectively treating some of those symptoms, and perhaps to the extent that it was reducing other drugs that may have been interfering with executive function, it seemed to improve executive functioning. So rather than making someone confused and stupid, as the stigma sometimes goes, it was actually the opposite, where people were sharper and more able to organize their thoughts on cannabis. In Mark Ware, who's one of the preeminent cannabis researchers in Canada and the world, did one of the largest controlled trials of cannabis for pain, and found that after a 1-year follow-up, those who used cannabis didn't differ on neurocognitive functioning compared to those who didn't. So that's a very thorough study, and that is an RCT. So in that case, it's sort of a higher level of evidence, again, suggesting no neurocognitive decline associated with cannabis use. When it comes to the non-medical literature, we see a slightly more mixed picture. And, Philippe had mentioned criminogenic factors, so things that lead people to break the law. And for so long, cannabis has been in that category of illegal activities. And there's certain personality traits and predispositions that are associated with criminal behavior. And those include poor attention and and lower IQ. So it's very difficult to attribute those differences amongst cannabis users to cannabis use per se, or is it part of being in a group that breaks the law? And you know, that's particularly true when we talk about adolescence, and there's so much rightly so much attention to adolescents, and because they're high levels of cannabis use and they're also developing cognitively. But when we look at adolescents who are regular cannabis users, and we see some mild differences in their cognitive profiles, we should remember that those adolescents are young people who are breaking the law almost every day. So they're going to be different from other adolescents in a number of ways that aren't directly associated with cannabis use. And as we see a destigmatization and mainstreaming of cannabis use so that it's not such a stigmatized activity, I think we'll be able to get a clearer signal around how cannabis users are really different in a way that reflects cannabis use rather than pre-existing differences in willingness to break the law and use drugs more broadly. So having said that, the reviews of the non-medical literature find some deficits in inhibitory control. So people have trouble stopping an ongoing activity. Some deficits in short-term memory, but no evidences of long-term persistent neurocognitive deficits after cessation of use. So some of the past reviews put it at about 3 months, but a recent review in JAMA, Journal of the American Medical Association, suggested that for some folks it's as little as 3 days that people show no evidence of cognitive decline associated with cannabis use. Finally, before I get to PTSD, you know, as clinicians, we're interested in risk of harm to self and others, of course. We know that something like alcohol and stimulants like cocaine and methamphetamine dramatically increase the likelihood that someone will become violent towards another person or will harm themselves. We didn't see those kind of results with cannabis. There's no reviews of medical cannabis use and violence and suicide, but in the reviews of the non-medical literature, didn't conclude that there was an association between cannabis use and violence. A really interesting study looking at domestic violence, which is one of my areas of research as well, it followed a large sample of married couples over the first 7 years of their marriage, and what it found was that couples that were both used cannabis had the lowest rates of domestic violence. And also, interestingly, it found that husbands who used cannabis were less likely to be abused by their wives. It's hard to know what to make of that. They stay on the couch, or or stay off the couch. I don't know. What depends what the rules are in your house. When it comes to self-harm and suicide, again, no relationship. That cannabis doesn't lead to increased suicidality. In general, I think the take-home of our review was, first of all, we need more randomized controlled trials to compare cannabis to other medicines. But in general, it looks like people are using cannabis to treat mental health conditions. People report improved anxiety and depression after using medical cannabis. And our understandings of anxiety and depression, when we look at the diagnostic criteria, when we look at the DSM, it's descriptive. So we don't have a blood test for depression. So if you say that you're less depressed, you're less depressed. And so I think in context where we're looking at things like anxiety and depression, this kind of self-report information is quite informative. When it comes to PTSD, as I mentioned, there's been a lot of attention there, and a lot of it's been because of some of the really brave activism, primarily of veterans, both in Canada and the US. And we talked a lot about substitution earlier today, and really, I've worked with PTSD. I worked in VAs in the US, and I've worked with people with trauma back here in Canada as well. And one thing that really frustrates so many people with PTSD is the cocktail of medications that they're prescribed. Often they have co-occurring pain, so they're given something for that. They may be getting something for sleep. They may be getting an opioid for pain. They're getting something for anxiety. And then there may be something else to deal with the side effects of that original cocktail. And so the potential of cannabis to replace not only one but perhaps several of these medications is so promising. And we do have good treatments for PTSD for some people, but for a lot of people they're either not effective or they're not able to engage in those treatments. So we need more treatments for PTSD. And we see so many veterans saying that cannabis has helped them, that cannabis has saved their lives. And when we consider the high rates of suicide and mortality and coexisting opioid disorder amongst people with PTSD, it's something we have to take very seriously. And there's no better example of patients leading the way than in PTSD, and the way that patients have grouped together to advocate for themselves is really inspiring. And it's made it possible for us to do some of the research we're doing now. We wouldn't be able to do that if it wasn't for the patients on the front lines taking those risks and trying to educate their doctors, and often arguing with their doctors, or doing whatever it takes to provide that medicine for themselves and their comrades. So the evidence is pretty strong for cannabis and PTSD. It's pretty complicated. We have preclinical evidence. We have evidence from animal models, so you can induce some of the alterations that are characteristic of PTSD in animals if you subject them to intense stress. And some of this early research found that if you administered cannabinoids to rats and gave them, subjected them to intense stress, they didn't develop PTSD in the same way. So there's animal, and there's a few other studies of a similar type. So we have preclinical animal data suggesting that cannabis can be helpful for PTSD, or at least the endocannabinoid system is implicated in PTSD. And when we look at some brain science and we do some imaging of folks who suffer with PTSD, they found elevated cannabinoid receptors in the brain. So it's almost as if the brain is underserved with cannabinoids. We have our own naturally occurring cannabis-like molecules, and what this shows is those molecules, those receptors, are involved in PTSD, and in people with PTSD seem to have a deficit, perhaps, in cannabinoids because they have these empty receptors. The receptors are available and not being filled. In a really interesting study done by one of our colleagues in Calgary, Matt Hill, looked at people who underwent the attacks of September 11th in New York, the World Trade Center attacks. And he was able to look at some of their circulating endocannabinoid levels. So again, our naturally occurring cannabis-like molecules. And so people who are exposed, if you look at that second one, 2-AG, that's 2-arachidonoglyceride, which is one of the naturally occurring endocannabinoids, people who had higher levels of that were less likely to develop PTSD after being exposed to the September 11th attacks. So again, suggesting that if you have a lot of this endocannabinoid circulating, it may protect you from developing PTSD when you encounter a traumatic experience. So that'd be the preclinical literature. Our review focused on the clinical literature. And we found 4 studies describing cannabis use among people with PTSD. In general, we found that a lot of people with PTSD report using cannabis, that they self-report good outcomes, and a slightly higher level of evidence with cannabis and reducing nightmares. So if you look at this, and I'll just move through this quickly, there's reductions in before and after starting cannabis therapy amongst people in New Mexico who had PTSD. They showed reductions across several types of symptoms as well as total PTSD scores. And in a study of a correctional sample here in Canada, where synthetic cannabinoids can be prescribed to prisoners, we see lower levels of PTSD and better functioning, better sleep, fewer nightmares associated with cannabis therapies. And nightmares are such a distressing part of PTSD. When we see something that can help relieve those nightmares, it can help people start get a better sleep, and then they can really engage more fully in some of the other behavioral therapies that might lead to a longer-term cure. So based on this, we are underway with our trial of cannabis for post-traumatic stress disorder, funded by Tilray, as I said, and working with Dr. Ian Mitchell and with Philippe Lucas and MJ Malloy as well, coming on board to help us with the trial. And they're doing a parallel study in the US. We're using vaporized cannabis, they're using smoked cannabis, and I think we have a better cannabis product. But pretty soon we'll know from both of those trials more clearly how cannabis can be used to treat PTSD. So just very quickly, before I finish up, I want to talk a little bit about cannabis, mental health, and pain, because as we said before, anxiety and pain move so closely together, and anxiety can make pain worse, and pain can lead to focusing on the pain in a way that's anxious. So one of the hypotheses that we had is perhaps cannabis works by reducing some of the pain-related anxiety. And we looked at a bunch of folks with arthritis, and some of them were using cannabis together with non-steroidal anti-inflammatories and opioid therapies. And what we found is that although cannabis is about the same when it comes to directly reducing the pain, there's no statistic differences. Blue is cannabis. It was better than the anti-inflammatories when it came to making the pain more bearable, better when it made it less irritating, but it outperformed both the opioids and the non-steroidal anti-inflammatories when it came to being less depressed about the pain. So it really may be that psychological aspect of pain that impacts quality of life and that is improved by cannabinoid therapies. We've also done some work with dispensaries, and it found similar things. These are folks from the Be Kind dispensary in Kelowna, and they are using cannabis primarily for pain, but of those people who are using cannabis for pain, over 70% said that it was also helping them manage symptoms of anxiety. So cannabis for mental health, but also cannabis may have a role in places where mental health and pain-related conditions are comorbid. And that's important because so many people with chronic pain are also using benzodiazepines. They're treating anxiety and pain with two medications, and that those things go together to dramatically increase the risk of fatal overdose, so much so that the FDA has a special warning for medications using both opioids and benzos. So if cannabis has the potential to be a substitute for both classes of medicine, then it can perhaps have even more benefit. So that's what I have to say about cannabis and poor mental health, cannabis and ill health. We're also interested in how cannabis might relate to well-being, and our current study that we're doing with students at UBC is looking at both positive and negative functioning and how it might change over the course of legalization. So we want to see how legalization impacts levels of use, but very interested also in how it affects other substance use. So it's our hope that so many of the problems on campus, I mean, we have a very nice, safe campus, but to the extent that there are problems, they're often related to alcohol use and binge drinking. And we're interested to see how cannabis might reduce that, and we have some preliminary data suggesting that it does. But we'll have more data about that maybe next time we meet, and we'll have a better sense of just what legalization does for the health and well-being of our university students. But I think the evidence to date gives us reason to be hopeful. And thank you so much. If you want to have any questions or want to contact me, please don't hesitate. Thanks.
Wonderful. You just said that there. Wow. Thank you very, very much, Zach, for your discussion and adding to this. I know everybody's been very patient, and much respect to all of you for being in the audience and going through 4 presentations in a row. It's time to take a break.